Welcome to the Untethered Airway Podcast, where airway health meets real-life impact. I'm Dr. Meggie Graham.
I'm Dr. Liz Turner.
And we're the moms and airway-focused dentists who founded the Untethered Airway Health Center. On this podcast, we're pulling back the curtain on the root causes of breathing and sleep challenges,
helping families and fellow providers understand how airway-focused care can change lives.
Because it's not just about teeth, it's about total body health.
Let's dive in.
Hi everyone, and welcome back to Still Struggling, the Untethered Airway Podcast series, where we take a closer look at the signs and symptoms that often get ignored. They get brushed off or downplayed, and they're therefore totally misunderstood, especially when they're rooted in breathing dysfunction. I'm a dentist, a mom, a patient, and I'm someone who's committed to making the invisible visible when it comes to our children's health. This specific series exists because of the overwhelming response I received after I published my article addressing the tone and content of several recent articles by Children's Wisconsin. From tongue ties to ADHD to feeding issues to sleep, these articles shared one unfortunate trait in common. They reassured without informing. They were dismissive, they were placative, and they were dangerously incomplete. Parents deserve better than don't worry, and kids deserve better than being told that their behavior is a problem, when in reality, it's an underlying health concern, like breathing. So today I'm going to dig into one of the most common misdiagnoses that we see in kids, ADHD-like symptoms that are actually signs of airway dysfunction. So I want to talk about the ADHD diagnosis and what commonly gets missed. Let me be clear, ADHD is real. I'm not here to diminish that. It affects millions of kids and adults, and when it's correctly diagnosed and managed, the results can be absolutely life-changing. But what I see really often is that it's a rushed diagnosis based on behavior alone without any evaluation of underlying structure or sleep quality or breathing. And these kids are labeled as inattentive or hyperactive, impulsive or oppositional. And when sometimes they're exhausted, their brains are stressed, they're in survival mode, and no one has ever asked, is this child breathing well? Are they sleeping well? Because here's the thing, if a child can't breathe well, they can't sleep well. And if they can't sleep well, they can't regulate. And when I mean sleep well, I mean good quality sleep. So often parents will say, well, yeah, they sleep fine. But what that means is that they don't come into their room and interrupt. They sleep through the night. But if that sleep isn't restful, or if that sleep isn't ideal as far as sleep architecture goes, they're missing so many important things. Let's talk science, okay? So during healthy sleep, especially REM or rapid eye movement, the brain does the essential work of restoring executive function. This is when our memory is consolidated and our emotions are processed and neurotransmitters like dopamine are regulated. But in kids with airway resistance, even mild, REM sleep is frequently disrupted. The brain keeps partially waking up to protect the body from low oxygen. Like, don't worry, I got you. Wake up, you can't breathe. Wake up, you can't breathe. And so it's constantly interrupting this cycle. And this pattern is called sleep fragmentation. It leads to chronic sympathetic nervous system or fight or flight. So instead of waking up rested and regulated, these kids wake up overstimulated and depleted. They're totally exhausted. And what does that look like during the day? For adults, we're groggy and tired and reach for more caffeine. But kids, they have poor impulse control. They have emotional outbursts. They have difficulty focusing. They're restless. They show signs of aggression. They're maybe foggy and fatigued. They're clingy. If this sounds like ADHD, it's because the behaviors are nearly identical. So what does the literature say? The literature here is extensive and it's really compelling. One of my favorites to talk about is a pivotal study by David Gazal. In that study, they found that even in the absence of full-blown sleep apnea or obstructive sleep apnea, sleep-disordered breathing in kids was associated with significant deficits in attention, memory, and in their school or academic performance. I will have all these cited at the end of the episode, so don't get hung up on that. I promise I'll share them with you at the end. They found that even mild sleep restriction or disruption caused children to show marked increases in hyperactivity and inattentive behaviors. And in a longitudinal study published in 2012 by Karen Bonnick and her colleagues, they found that children with snoring, mouth breathing, or sleep apnea before the age of 7 were 40 to 100% more likely to receive a diagnosis of ADHD by age 11. That's wild. I'm going to repeat that because I think those stats are so compelling. 40 to 100% of kids that had mouth breathing or sleep apnea or snoring were more likely to receive a diagnosis of ADHD by age 11. This is not just a small overlap. It's a massive overlap. So what causes these breathing problems? A few common culprits are enlarged tonsils or adenoids, so soft tissue that's too big and takes up too much space in the airway. A narrow vaulted palate or roof of the mouth, that is the same bone as the floor of the nose. Recessed jaws, upper jaw or the maxilla, and a lower jaw that's set back in the face. Mouth breathing, low tongue tone. Did you guys know that the tongue is supposed to sit on the roof of the mouth in its entirety, like totally stuck up against the roof of the mouth? So often the tongue is low and kind of hangs out of the mouth, and when that happens, it takes up more space and it can obstruct the airway. Tethered oral tissues can be a cause of that. Improper nasal breathing from habit or congestion. These are all things that can be very additive in why people are having a hard time breathing. These structural issues create resistance in the airway, especially during sleep when gravity also plays a part. That resistance increases the effort to breathe. So the body has to work a lot harder to get air in. And even if the kid isn't fully waking up, they are not getting rest. Their sleep cycles are being disturbed. And remember, many of these kids never ever snore. Their sleep looks fine, but their brains are working overtime just to keep them oxygenated. Over time, this changes how their entire nervous system functions, not just at night, but during the day too. So I want to give you an example. I recently saw a 9-year-old whose parents were told that he probably had ADHD. He was constantly fidgeting. He couldn't sit still in class. He had behavioral issues. He had a short fuse, and I actually even witnessed that in the office. He was just wound up. But here's what they noticed. When they started paying closer attention, he slept with his mouth wide open. He snored just a little bit. They also noticed that he ground his teeth, and he was exhausted in the mornings. He hated waking up, and it was always a fight that started their day. We did an airway screening. He had a narrow vaulted palate, very constricted dental arches. He had low tongue tone and a history of early feeding issues. He didn't need medication. It was not bad enough to be treated medically. Doctors talked about medications with the parents, but they were hesitant to put him on anything, and they had actually done some online digging and heard about airway, and so they wanted an airway assessment, and that's actually what he really needed. Whether or not it's related to his ADHD, he also can't breathe well, and he also has structural concerns that we can help with. So we did a whole combination of things. We did myofunctional therapy, we did orthopedic expansion of his maxilla, and we talked to his parents to make sure that we were regulating their expectations that this is not magic. This is just idealizing structure and making function better. And oftentimes those symptoms that were misdiagnosed as something different go away. But I wasn't promising to cure their son of ADHD. I just said we can make his structure better. We can put the bony foundation in a better spot. And actually, lo and behold, he started sleeping better within a month. His tantrums stopped. His teachers called and asked what had changed. And this story is not isolated. We hear this all the time. Now, I want to be mindful to providers that are listening. Don't promise to solve all the problems. Where we have the most ability to make change is recognizing that this is a complex body and there's so many things that go into it. And when we stop and recognize that there are different pieces to the puzzle, that's when our puzzle pieces can be as impactful, like we did in this kiddo, where we made his mouth bigger and we made his breathing better. So what changed for him was that he was able to get better oxygen, he was able to sleep better, and he was actually feeling better and more rested. So here's the part that's actually really heartbreaking. These kiddos often feel shame. This little boy that was brought in by his parents is an awesome story. It's a success story, and I am so glad that we get to do what we do. But all of these other kids out there that don't have parents that are aware that this is an issue, or providers that don't know to look for this, often are diagnosed and they feel shame. These kiddos are told to try harder, and they get moved to a behavior chart. They're put on special academic plans, and they're labeled the bad kid in class. But they're not bad. They're tired, and they're trying harder than anyone knows. Parents feel it too. They're often blamed for a child's dysregulation when really, in reality, no one has taken a full look at the child's function and physiology. So when we miss the airway, we miss the foundation, and the downstream effect is years of mislabeling, unnecessary medication, and putting out fires that could have been avoided from the first place. It's a total missed potential. So if you're wondering whether airway might be a factor in your child's behavior, here are a couple things I want you to look for. Mouth breathing is a big one, and it doesn't have to be this big, obvious sign of mouth breathing, this gaping, wide open mouth. It could be lips parted and they're just breathing quietly through their mouth. It could be during the day, it could be during the night. Snoring, even lightly, is something to be concerned about. restless sleep where they are tossing and turning and kicking and sweaty, if they're grinding their teeth, if they're waking up tired despite a full night in bed, these are things that are red flags that should be looked into. I never want to create a problem that doesn't exist. I say that all the time, but it's also the responsible thing to do that when red flags present, that we don't ignore them. Other things to think about are, chronic congestion or allergy symptoms, history of reflux or ear infections, speech delay, food refusal or gagging, difficulty regulating their emotions or having a hard time paying attention. If some of these sound familiar, it really is time to take a closer look. And then the next big question is, what do you do? If you're a parent, start by recording your child sleeping or paying attention to what these list of symptoms that you're noticing are. If they are having snoring episodes or mouth breathing at night, just even 30 seconds of video can be really revealing. Share it with your provider trained in airway, or a pediatrician, a sleep dentist, an ENT, a myofunctional therapist, somebody that understands this connection. If you're a provider, especially in pediatrics, speech, occupational therapy, or mental health, add these questions to your intake forms. How does your child breathe at night? Do they snore? Do they grind their teeth? Do they wake up rested? It might not be your specialty, but if you see the signs, you can help open the door to a real conversation and maybe even a solution. So these are my final thoughts. I'm not saying that all ADHD is misdiagnosed. What I am saying is that airway should always be part of the conversation, because when a child is tired, they just can't regulate. When they're not breathing well, they can't concentrate, and when their sleep is fragmented, their behavior reflects it. So if your kiddo is struggling, don't just look at the behavior, look deeper, look underneath. Behavior is communication. Sometimes it's saying, I can't breathe. I'm Dr. Meggie Graham. Thanks for joining me on Still Struggling. In the next episode, we'll talk about kids who are always sick and why chronic respiratory issues may also point back to chronic breathing issues and growth issues. Have a great day. Thanks for tuning in to the Untethered Airway Podcast.
If today's episode helped you see things differently,
Please share it with someone who would benefit from hearing this. And don't forget to subscribe.
want to learn more about airway health or connect with our team?
Please visit our website, untetheredairwayhealthcenter.com, or follow us on Instagram @Untethered Airway.
Until next time, bye.